The mission of our telemedicine department here at Children's Mercy is to improve access for children that live in rural areas, children who are in underserved areas that may be densely populated but they don't have good access because they don't have transportation or they don't have the economics to allow them to seek subspecialty care. Our overall goal is to improve the health and well-being of children in the Midwest by allowing them to access our providers with the least effort possible on their part.
Children that live in smaller communities that don't necessarily have access to these pediatric specialists benefit from telemedicine because it provides direct access to specialists.
Telemedicine makes it possible for children who may have a very specific illness to reach a provider that they otherwise would not be able to. Telemedicine is one of the ways to help improve access and decrease costs for rural families who would have to drive 6 hours to access a specialty center like ours here in Kansas City.
We're in the process of developing a fetal surgery center here as an offshoot of our Fetal Health Center. Fetal surgical procedures are only provided by very highly specialized centers, and there's only a handful of them in North America. There's one lacking here in the Midwest, and so it's important that we're able to provide those services to save families from having to travel significant distances to otherwise obtain this care. We've developed remote collaboration here at the hospital because we are learning new cutting-edge techniques that we want to provide to the patients and families in our community. Part of that requires us to be able to remote in with inventors and pioneers in different surgical techniques to be able to facilitate our application of those techniques here at Children's Mercy Hospital.
Children's Mercy developed a pulse ox program. We have a phone number, 1-877-PULSE-OX. Anytime a community provider screens a baby and they get a positive pulse ox screening for critical congenital heart defects, they can consult in immediately with one of our neonatologists here at the hospital. We can see if further screening needs to be done, and they can also talk with a pediatric cardiologist. So if they don't have those resources at those hospitals, they're able to utilize our resources here.
Telehealth improves pediatric rheumatology very simply. In reality, we're able to reach out to patients who need us. There are very few of us in the United States, upwards of 300 board-certified pediatric rheumatologists in their entire states that don't have representation. So this allows us to reach out to patients who otherwise wouldn't have access to our care. Up to 75% of pediatric rheumatology patients are seen by adult practitioners. So for pediatricians, it's really important for us to be able to see those kids and to have the ability to provide pediatric care to kids who need it.
Telehealth helps me help others by providing quick access to health care. Here in neurology, we've seen patients within a week or two of being referred. For instance, for our telemedicine program, we see new onset seizures, rule-out seizures, absence seizures, febrile seizures. Those are the types of patients that we see. Telehealth at Children's Mercy and neurology work together a little bit differently than in other circumstances. The two providers that have been using telemedicine are actually out of the country. One was in Portugal, one was in Saudi Arabia on a leave of absence. But we continue to get their patients in via telemedicine.
Telemedicine provided me with the incredible opportunity to continue to see my patients even if after I relocated out of the country. So the 7,000-mile distance between us is no longer an obstacle.
In Kansas City, we have a really interesting dynamic. We treat a large population of patients in the city, but we're also the catchment area for many states.
In the future, Children's Mercy Hospital will expand the services of telehealth to include all of pediatric subspecialties.
It is our aspiration, and certainly mine, I'm very passionate about our Department of Telemedicine, that we will have the remote presence technology interwoven in every one of our areas of subspecialty. There's really not a discipline that cannot benefit from some sort of audiovisual technology to help deliver care over distance.